I'm Sunil Bhoyrul, I'm a surgeon. Like many of you, and so many of you today, in your passion and in your profession, I want to do everything to the very best of my ability. So, I read lots of books, and I learned lots of technical skills, and I kept up with all the innovations. And, that's great. I work in a state-of-the-art facility. It's really amazing, right? We're surrounded with some really, really bright people. And then we have all these machines that make these funny buzzing and beeping sounds. It's really cool. You'll love it. You should come and visit. But despite all that, things don't always go as planned. Okay, so Howard came to the hospital. And when I first met him, he was nearly dead. He was lying there. There was actually blood gushing out of his mouth. There was some guy doing CPR in his chest. Things didn't look good. Howard's chances of survival were essentially almost zero. But luckily for Howard, he'd come to the right place. This was where we had a team of incredibly dedicated people. Everyone from the receptionists, the technicians, the nurses, the doctors, everyone knew exactly what to do. So we took him to surgery. We spent hours in surgery. We spent days in the intensive care unit. And after weeks on the hospital floor, Howard left. It was great. He's out there. He's smiling. He's on a wheelchair. Huge save, right? You take a guy who's you're doing this, and then a few weeks later, he's doing that. Now, the problem is that while he was with us, he developed a complication, a preventable complication. Something went wrong. We recognized it, we fixed it, and we owned up to it. But it was still a huge save. We still get this guy out alive and smiling. But, the first thing that Howard did when he went home was he called his lawyer, and he sued us all. And I was flabbergasted. I thought, my God, how do we go from this 21st century $1 million life-saving effort where we gave it our all, and the guy whose life we saved was willing to stand up and say hurtful and mean things about us in a court of law? There was something wrong with this picture, and I just didn't understand it. And I guess when I reflected on it, in order to understand that, we need to understand medicine itself today. You see, medicine is at an inflection point. About 50 years ago, the doctors knew everything that could possibly be known. Many of them did everything. They were gynecologists and surgeons and everything. And, they were just great human beings, too. They had the art and science of medicine with a personality of healer, priest, teacher, scientist, everything. And then the last 20 years, the digital age brought with it this explosion of what seems to be almost infinite knowledge and infinite information. It's been fantastic. Of course, the knowledge and the information that exists far surpasses the capability of any single physician. So the way in which we're able to cope with all that, the way in which we store, we integrate, we analyze this information is with the electronic health record, all right? Electronic health record. So the electronic health record is a truly amazing thing, right? This thing here can tell you everything. It can tell you what your chances of developing cancer are. It can even tell you how well you slept last night, right? And it's so amazing that it really defines 21st century medicine, almost as much as the stethoscope did 50 years ago. Every doctor has an electronic health record. The government will even reward you if you have one, and they'll even fine you if you don't have one, right? So what a great tool. What an amazing way of delivering infinite knowledge. And yet, that's actually part of the problem. Because as we develop this amazing flow of data, we've sort of lost some of the definitions of why we become doctors in the first place and what medicine's really about. And in that electronic health record, what we have is just a lifeless collection of data points. And in many ways, that led to some of Howard's issues. And so, in my opinion, if we're going to get beyond electronic health records and breathe life back into medicine and back into EHRs, we have to redefine it. We have to get beyond electronic health records, and we have to talk about excellence, humanity, and respect. That's what EHR should really stand for. So, what do I mean by that? By excellence, I mean taking all that electronic data and forming a human connection. You see, because without that human connection, the data is useless. And by the way, for a connection, as doctors, there are 3 elements to a connection. You got to look at your patients, you got to listen to your patients, and you got to touch your patients. Without those 3 elements, you haven't made a connection. So let me give you an example. When I was in training, I was asked to present a patient who had just been diagnosed with pancreatic cancer on ward rounds. Ward rounds, by the way, are very big when you're training. That's when you get to show off. You say, hey, I know my stuff. Anyway, so I went there and I spent some time with my patient. I got to know her. And then I spent a lot of time with her electronic data. I knew everything about this lady. I knew her CAT scans, her blood tests, her tumor markers. I researched all her treatment options. And then when the time came, I stood outside her room with all my colleagues in front of the professor, and I delivered, at least what I thought at the time, was a perfect presentation. And then when I finished, in front of everybody, all our crisp white coats, my professor looked at me and he said, "What color were her eyes?" And I knew then that I'd failed. And I'd failed because what I had was essentially a useless set of data points. And without connecting that data to the patient, to the woman who had pancreatic cancer, I had not achieved excellence. If electronic data is going to become excellent, you need to look, you need to listen, you need to touch. And to this day, I look at all my patients in the eyes. We're all wearing sunglasses, by the way. So I look at all my patients in the eyes. I listen to all my patients as best as I can, and I remember to touch my patients. That's what excellence is all about. The H in EHR stands for humanity. Humanity is about going beyond what we do, and more importantly, connecting with the human being in front of us and figuring out why we're here in the first place. And that's what humanity is. Another example. So in my operating room, as in every operating room in the United States, we have a safety checklist, something called a timeout, right? So when the patient's asleep and she's under an anesthetic and she's completely sterile and we're all ready to go, and just a split second before we're getting ready to make an incision in her skin, the nurse yells, "Time out!" And we all stop what we're doing and we go through this checklist. We verify that we have the right patient, the right location, the right tools, the right surgeon, the right medication, everything in the room. And timeout's great. You're far less likely today to have the wrong leg cut off than at any time in the past, which, believe me, that's a major loss of style points, right? So, whatever, right? But anyway, the problem with the timeout, as good as it is it tells us nothing about the person whose belly we can see. And so in my room, after we have the timeout, we have a time in. And a time in is a vignette that the person who knows the patient the best tells everyone in the operating room after she's asleep why she's here. So it turns out that this woman here, her name is Edna. She's 49 years old. She has stomach cancer. And today is her last chance to beat stomach cancer. But much, much more importantly than that, what Edna said to all of us before the surgery, Edna's a school teacher to underprivileged kids in Chula Vista. All she wants, more than anything else in the world, is to get back and teach her kids. And you can bet that as we're getting ready to operate on Edna, all her kids are rooting for her, and some of them are even praying for her. And I sincerely believe that if everyone in the room understands why Edna is here today, that Edna will have a better outcome. And that's the H for humanity, all right? And the third R, EHR, R is for respect. In the first vignette, where Howard sued us after we saved his life, clearly there was a breakdown in respect, probably both ways, between patient and caregiver and caregiver and patient. But respect needs to be a mutual thing. Respect is about us as caregivers listening to a patient's age, gender, sexual identity, religion, culture. And if we go the extra mile and we have the appropriate religious or cultural greeting, that's great. We're saying to another human being, I will not judge you, so please don't judge me. So what's my take-home message? My take-home message is this. The next time you engage with your doctor, expect excellence. Expect that your doctor will look at you, will listen to you, and will touch you. Help your doctor with humanity. Tell your doctor not just what your expectations are, but why it's important for you to get better. Why do you have to beat diabetes? Why do you have to lose weight? Why do you need to cure depression? Why do you need to cure cancer? And that why will allow your doctor to engage with you, and I believe will give you a better outcome. And then respect. Respect is mutual. For all of us as caregivers, for many of us as caregivers, I believe that we give our every living, breathing moment to taking care of you. So if things don't go well 100% of the time, then maybe respect the fact that when I came here today, when we all came here today, we brought every living, breathing, good intention to you today. Thank you very much.